Varicose veins hurt and can lead to blood clots, and they're unsightly too. If you have painful leg veins, now you can do something about it. I'm Dr. Laura Ellis. I'm a vein surgeon, and for over a decade, I've helped men and women live happier, healthier lives. With a comfortable laser procedure in my office, you can go back to normal activities the next day, and it's covered by Medicare and most insurance. Give me a call. It's time to take care of you.
Welcome back. Well, today we have on Dr. Laura Ellis, who wrote the book, The Hormone Handbook, and she is with medAge, and we're going to talk about that. Nice to have you back again today.
Thank you.
So tell me what medAge Comprehensive Healthcare is.
medAge is a comprehensive healthcare program for people who are in their 30s, 40s, 50s, and beyond to help prevent and reverse the common diseases of aging.
Okay.
Yeah, such as heart disease and diabetes and arthritis and dementia, cancers.
Now, so what is the approach to that? And it sounds like this is a wellness approach. And so what are some of the steps that are incorporated that?
Yeah. When I see a patient for the first time, I do an extensive panel of testing, including blood tests and other tests, to discover early signs of disease, such as diabetes or risks for cancer. And then I design a healthcare program for that individual patient, it's very customized, to reverse those diseases and to help prevent, say, lower the risk of cancer or reverse some of the signs of dementia and heart disease. Yeah.
And how is this different than going to your regular primary care?
It's different because I use a very customized approach for each patient, and I spend a lot of time with each patient. It's very difficult for most doctors to spend the amount of time that everybody, as they're aging, needs to help, say, reduce their risk or reverse their hypertension. In some cases, high blood pressure can actually be cured rather than just treated with a medication. So I spend a lot more time and do a lot more investigation and customized care with each patient. That's how it's different. It's very difficult for other doctors to do that with the time constraints they have.
Okay, what about, your book is called The Hormone Handbook, so of course we're going to talk about that. Are hormones involved here, or is that a supplement?
Well, in some cases, yes, hormones are involved. A lot of people are afraid of hormones, or they just don't understand how hormones can help reverse and prevent aging and improve the quality of life. So in some cases, yes, I test for hormone levels, and if they're low, then I do prescribe them and follow them very closely. And this is very important because it can reduce the risk of heart disease and breast cancer and other forms of cancer and many of the diseases we associate with aging.
Okay, as far as that type of treatment, does it depend on someone's age? Obviously, this community, the average age, I think, is something like 77.
Yeah, absolutely. I have patients ranging from the 20s into the 80s, and actually one patient who's in her early 90s, and they all benefit. So, yeah, aging can start very early, and of course it continues as you get older. And I make a distinction between getting older and aging. Getting older happens to all of us, but aging is the process of deterioration as you get older.
Yeah,
That's what we want to reverse and prevent.
Yeah.
So any age.
That's very true. I guess that's why you see people who are 40 that look like they're 60, right?
Exactly, or people who are 60 who look like they're 40.
Yeah, exactly. And as far as the hormones, and as we age, women go through menopause, men have maybe lower testosterone, and so on. That's part of that is you can't prevent, but you can go ahead and and treat it in some way, right?
Absolutely,
Yeah.
absolutely. And it's not just about menopause or what we call in men andropause, when their testosterone begins to get low.
Okay.
And it happens to nearly everyone. So by replacing some of the missing testosterone or estrogen, progesterone, many of the hormones that we associate with getting older, we actually can reverse some of the aging process, and patients feel better. And what's really important to know is that when testosterone is low, for instance, in a man, they not only feel tired and fatigued, their body composition changes. They lose muscle mass and strength, and they lose cognitive function. They don't think as clearly, they lose their edge. So they not only feel bad, they are deteriorating.
Right.
So to replace that can help build the muscle back, can help them think more clearly and feel better. And I like to say that, you know, when someone approaches me and says, well, that's just a natural part of aging. Well, yes, it is. However, so is losing your eyesight, but
Right.
we certainly correct that. And so why not correct testosterone and feel better and function better?
Right. What is your background, basically?
Well, I'm a
How did
surgeon.
you start out in this?
Yeah,
Okay.
I'm a general surgeon, and it's not, wellness medicine is not typically a part of what a general surgeon
Right,
does.
exactly.
But I'm 52 years old, and when I was 46, I started to really experience a decline, and I hadn't changed my lifestyle, say the way I eat and the way I exercise. But I wasn't thinking as clearly, and I wasn't sleeping well, and my body composition was beginning to change. I was starting to get a little fat around the middle, and I just didn't feel as strong, or as I didn't think as clearly. So I realized that what was happening was I was having hormone imbalances. And I wasn't quite in menopause yet, but I was still having hormone imbalances. So I corrected that, and I slept better, and I thought more clearly, and I felt better, and I was stronger, and so I'm healthier overall. So that allowed me to see more clearly how that benefits all of my patients, even
Yeah.
though they're surgical patients. So I started medAge, which is this the comprehensive wellness program, and now that has become my passion.
Right.
Although I still am a surgeon, I still do surgery, I also do this. And this has grown across the country. You know, I have offices on the East Coast, and now I'm working out here in California in Laguna Beach.
Very
And,
good.
yeah, so.
One question that obviously the people living here are going to ask is, how does this dovetail both into their primary care and also Medicare?
Sure. I don't take the place of their primary care doctor.
Okay.
They still need that primary care doctor.
Okay.
However, they'll need them less if they have me involved as well. And I work with their doctor to make sure that we're all on the same page and their health care is as comprehensive and customized for them as it can be.
Sure.
So they still need their primary care doctor. But as far as Medicare goes, you know, as a surgeon, I take Medicare for the surgical procedures.
Right.
Medicare doesn't cover this kind of comprehensive health care, but it's worthwhile, and patients can pay me directly for it, and it just depends on what their needs are as to what that looks like.
All right, I want to give the local phone number down in Laguna is 949-632-8087, and the website is mymedage.com, so you can get information there, and I guess from there they could hook up to get your book, right?
Absolutely.
All right.
Yes.
And it's called the Hormone Handbook. I'm sure it's available on Amazon as well, right?
It will be at the beginning of the year.
Okay, very good. Because if they're like me, they like the Kindle edition. So
Yes.
don't like carrying around books
Yes.
anymore. Thank you. Nice to see
Oh,
you again,
thank you
Laura.
very much.
And happy holidays to you.
Thank you very much.
And we will be right back. That's interesting.